Every 11 seconds, an older adult is treated in the emergency room for a fall. It is the leading cause of fatal and non-fatal injuries among seniors. But what if the healthcare system stopped waiting for you to fall and started paying to keep you on your feet? For decades, Medicare operated on a reactive model. They would gladly pay $50,000 for your hip replacement surgery, but they wouldn't pay $50 for the grab bar in your shower that could have prevented the accident in the first place. But in 2026, the landscape of senior health benefits is experiencing a massive shift. Driven by the staggering cost of fall-related treatments, Medicare is aggressively expanding its focus on proactive prevention. Today, we are breaking down the 2026 Medicare Falls Prevention initiatives. We will look at the emerging frameworks like the LEAD program, analyze exactly what Original Medicare and Medicare Advantage actually cover, and evaluate whether these new benefits are a lifesaver or just an illusion. Let's start with the facts. Under current Medicare Part B guidelines, your annual wellness visit now places a heavy emphasis on full risk assessments. Doctors are financially incentivized to screen your mobility, review your medications for dizziness side effects, and prescribe physical therapy. Now here's where it gets interesting. While Original Medicare provides the foundational coverage, many Medicare Advantage plans are going much further. Some now cover home modification assessments, occupational therapy home visits, and even smart home sensors that detect unusual activity patterns. One of the most promising frameworks emerging is called LEAD. Link, Evaluate, Act, Deliver. It's a coordinated care approach that connects your primary care physician with specialists, physical therapists, and your family to create a personalized fall prevention strategy that evolves with your needs. So what can you do right now? First, schedule that annual wellness visit and specifically ask about a full risk assessment. Second, review your Medicare Advantage options to see what home safety benefits you might be leaving on the table. Third, start a conversation with your doctor about physical therapy. The 2026 Medicare Falls Prevention initiatives represent a fundamental shift in how we think about aging. It's no longer about waiting for something to go wrong. It's about investing in your independence, your dignity, and your quality of life. The healthcare system is finally learning to pay for the grab bar.
To truly analyze these benefits, we have to split the system in two: Original Medicare versus Medicare Advantage. If you have Original Medicare, the coverage is strictly clinical. They will pay for the physical therapist to teach you balance exercises, but the buck
Original
stops
Medicare
there.
generally does not pay for home modifications.
No grab bars, no wheelchair ramps, no stair lifts. But this is where Medicare Advantage, or Part C, drastically changes the game in 2026. Private insurers have realized that through special supplemental benefits for the chronically ill, many 2026 Advantage plans now offer dedicated allowances for home safety improvements. They utilize frameworks aimed at locating risks, evaluating mobility, adapting the home, and defending against falls. The analysis also reveals a massive push into wearable technology. High-end Medicare Advantage plans are increasingly subsidizing smartwatches with built-in fall detection and personal emergency response systems. It's an integration of tech and health benefits that... So on paper, the 2026 landscape looks incredible. free physical therapy, subsidized bathroom renovations, and high-tech watches. But as with all things in healthcare, we must evaluate the fine print.
Here is the reality check and our evaluation of these programs. While Medicare Advantage heavily markets these home modification benefits, they are often tightly capped. You might get a $500 annual allowance, which barely covers the labor of a licensed contractor, let alone the materials. Furthermore, these benefits usually require pre-authorization, a doctor's specific prescription declaring you chronically ill, and the use of strictly in-network vendors. Many seniors find the bureaucratic hurdles so exhausting that they simply give up on claiming the benefits they were promised during open enrollment. So, what is the conclusion? The 2026 Medicare shift toward fall prevention is undeniably a step in the right direction. The system is finally acknowledging that aging in place safely requires proactive investment, not just reactive surgery. However, you cannot rely entirely on your insurance to child-proof your senior years. As a beneficiary, your action plan is clear. During your next wellness visit, explicitly demand a fall risk assessment from your physician. Get it on your medical record. When shopping for Advantage plans, ignore the glossy brochures. Ask specifically about the dollar cap on home safety modifications and the network of contractors. The tools to prevent a life-altering fall are finally being funded. You just have to know how to unlock them. Take action today. Visit Medicare.gov, compare plans carefully, and remember that preventing a fall is always better than treating one. Your safety and independence are worth the effort. Thank you for watching Part 3 of our Medicare Falls Prevention series.